I wanted to start with the experiment that you have been doing the last 6 months for health and wellness. I have watched you, just watching you do the push ups. I'm like, oh my gosh, I could not do that. But how did that get started and why did you decide to do it?
First of all, I challenge or will push back on that. You don't know that you can't do that. I thought I couldn't do it either, but it was something that started just as something I wanted to do for myself. I had just stepped away from a 14-year position at ABC News where I was waking up every single morning at 4 or 5 o'clock in the morning to go to work. And I thought, okay, I'm going to have a little bit of a different schedule, which I was excited about. Let's see. I wanted to do this experiment, and I deliberately, in my mind, to myself, called it an experiment where I would try over a 6 month period of time to get into the best health, wellness, fitness that I could achieve out of a sense of curiosity. I'm 55. I knew I wasn't in my best fitness level. And it's not like I was, doing nothing, but I just felt, my back always hurt. If I was at a party, I'm not joking. This is embarrassing to admit, but if I was at a party where I would be dancing with my husband or, one of my kids or a friend, I would literally be out of breath in one song. So I had lost my party fitness. I wanted to look, 55 years of age in menopause, skin starts to sag. Skin sagging is one thing, muscle sagging is something else. And so I said, okay, I'm going to try this 6 month experiment. I announced it on my Instagram, DRJ Ashton. Thank you, by the way, for following it. And there were over 1 million views, and people became really interested, supportive, inspired, obsessed with it. And I've been kind of updating people along the way. And I have learned so much. I partnered with an incredible trainer, Corey Rowe, and we are bringing a lot of this information to our followers in a way that literally I have women in their 70s who are DMing me on Instagram saying, I want to start to do this. How do I do it? So we're putting it all out for people in the next couple of months, but people can follow it along on my Instagram and in my newsletter, by the way, which is free every
Agenda.
week. Join the
Yes,
agenda.
agenda. Love that. And
Agenda
we'll
like
get
Jennifer. But it was all it was really all about curiosity.
women are just not getting out there and advocating for their own health and wellness. And I think you doing so and being a great representation is really going to help a lot of women. Why do you think it is still so hard for us to be our own best medical advocates?
Uh, that's the big question. That's the $1 million question. I don't have an answer for it. I can only tell you again, and full disclosure, embarrassing admission that I've even been guilty of that when I'm the patient, right?
It's true.
So,
Right.
if you have a doctor who's double board certified and that can happen to me, it can happen to anyone. And I think, part of it is societal, part of it is psychological, part of it is cultural, part of it is generational. Who knows? There's a zillion reasons for it. All I know is that, I've been in practice almost 20 years. I've spoken to millions of women in my role as former chief medical correspondent at ABC News, and other networks before then. I've had thousands of patients, and we are just generally conditioned to not prioritize our own health, to even question things that we're feeling or experiencing. And then everything can kind of domino effect suffer from that point on. And look, I was guilty of this, Colleen. I literally, by the way, what I'm about to say, I've never said before publicly. So
Ooh,
yeah,
okay.
I'm
I got a
giving you
scoop.
a nugget. When I went through menopause, which was in the last 5 years, I literally had every symptom, head to toe, that you have read about, heard about, learned about, or whatever. And I did not recognize that they were symptoms of perimenopause and menopause
Oh
until
no.
like a year ago. And I'm a board certified OBGYN. People think that here's your options: hormones or suffer. That's it. And even some healthcare professionals think that. But certainly a lot of women in the lay public, that is what they've been told, and they don't know about other options. And so I felt personally compelled, as the mother of someone for whom any kind of hormones will never be an option, to say, look, we always have to go back to the premise, the classic proper way of medical management and treatment, which is to present all options, risks, benefits, and alternatives. And when you talk about suffering from moderate to severe VMS, vasomotor symptoms, hot flashes and night sweats, whatever you want to use to refer to them, there are hormonal options, there are non-hormonal options that are by prescription. There's other cognitive behavioral therapy has been studied, but women are usually given one option and that's it. And I just felt so strongly, Astellas is doing such a good job with, I'm sure you've seen or heard about the new platform, mycoolermoments.com. It's
Mhm.
kind of just a great education, discussion, community platform that women can get informed, figure out what to bring to their healthcare provider to discuss if Veoza or any other management option is right for them. And that is, at the beginning and end of the day, what I feel so strongly about as a doctor and as a woman.
What would you say are some of the most important questions women can ask when they walk into their doctor's office about menopause
Well, the
if they're
first
struggling?
question, yeah, the first question, and I think this isn't necessarily a question, but it's an awareness, that I think every person should know, including men, because most men have at least one woman they care about in their life, on some level, is that symptoms of menopause can start in a woman's mid 30s, as you know, mid 30s.
Lucky us.
And so it's not, oh, you have to be 50 or you have to be 60 or you have to be 55. There's no like line in the sand where a woman is quote unquote too young for it. And so that woman needs to know before she walks into her doctor or healthcare provider's office that she knows her body best. And so anything that you notice that deviates from the norm, you should be kind of like your medical detective or your medical reporter or journalist and say as much as you can about that observation, that symptom, or that sign as you can. When did it start? How bad is it? How often do you notice it? What makes it better? What makes it worse? How much of a problem is it in your life? I would recommend that women don't follow what I did, which is minimize, ignore, deny, say, no, 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 no. That's, it is 2024, almost 2025. We should not be doing that. And so I think it starts with just recognizing that you are the expert in your own body. So when you go into your doctor's office, and it doesn't have to be for your annual exam, yes, you can make an appointment and say, I would like to come in and talk about things that I'm experiencing that I think may be related to perimenopause or menopause, and then find out what are my treatment options. I used to refer to this like a menu of options, literally, like you can choose one thing from column A or one thing from
Like a
column.
Chinese menu.
Yeah, literally. And so, I think women should ask their provider, and this is where the patient doctor relationship really should be a two-way street, right? It's not a dictatorship.
Right.
It is definitely should not be that. So in some cases, the patient could actually be bringing information to the provider or doctor that he or she might not have heard before. Veoza is a perfect example of that, right? So if you say to your doctor, I heard there's a 100% hormone-free option for moderate to severe hot flashes and night sweats, and your doctor says, I haven't heard of that. That good doctor, that doesn't mean, oh my God, find a new doctor. That good doctor should then educate herself or himself and say, I haven't looked into that yet, but guess what? I'm going to, and I'm going to get back to you. And then, you can move on and figure out whether that's an option for you. If you're talking about someone with the condition of obesity or with the condition of overweight, and believe it or not, that's what it's called. It's not being overweight, it's a condition of overweight. Don't ask me who
Okay.
grammatically picked that one, but it is. They have a larger percentage of muscle mass, but just based on their weight, but it is dysfunctional / pathologic muscle. Okay. So when they lose more muscle with their weight loss, when they're on a GLP-1 drug, not all of that lost muscle is well-functioning, healthy muscle, right? So this gets us into this arena, which I talk about a lot in my newsletter, but whether it's talking about GLP-1s or whether it's talking about Veoza or any other medication, this is where thinking like a doctor is so important. It's not what's the risk of the drug versus don't take the drug. It's what's the risk of the drug and what's the risk of a person with obesity not taking the drug and continuing to be obese? Significant, right? So though that's not a question mark. We know conclusively what those risks are. So if there's a treatment that will result in a significant amount of weight loss, which these drugs have been shown to do, okay, in conjunction with a healthy lifestyle and good behavioral modifications, that is worth the risk of a person losing 45 to 50% of their lost weight from muscle, right? And especially when you can say, well, then what do you do about that? Well, if you know that you're on a medication that has that risk, are there things you can do in your behavior that can kind of moderate or mitigate that risk? And the answer is yes, there are. Eat a diet that's high in healthy protein and lift weights so that as you're losing weight, if you're someone with a BMI that falls in the obesity range, you're actually building new healthy functional muscle.